Hey Freedom Lovers, this is Dr. Peterson Pierre with America's Frontline Doctors bringing you today's Daily Dose. Let's see if you recognize these names. Cymbalta, Prozac, Paxil, Zoloft, Lexapro. These are all commonly prescribed antidepressants. But Prozac is the only one listed here whose patient insert includes the information that the sexual dysfunction caused by the drug can persist even after treatment has ceased. The FDA is being sued for its failure to warn the public of this devastating adverse effect. The FDA was first petitioned on this issue and asked to encourage doctors to issue warnings to their patients back in 2018. 6 years later, and nothing has happened. Prozac's patient insert only includes the warning cautiously phrased because its manufacturer, Eli Lilly, actually asked the FDA to add a few words back in 2011. The FDA complied, but for some reason omitted to draw the logical conclusion that all drugs in this category should have a similar warning attached, even though the dangers of these drugs have been known for decades. And an estimated 1 in 10 Americans over the age of 12 are taking them. Dr. David Healy and 21 other professionals submitted their original petition not only to the FDA but also to the European Medicines Agency, EMA. The EMA responded in 2019 with a, quote, new product information wording, end quote, which stipulated the language to be used in patient inserts, warning potential users of these drugs of, quote, long-lasting sexual dysfunction, where the symptoms have continued despite discontinuation, end quote, of the drugs. In 2021, Health Canada followed suit, declaring that it would henceforth, quote, work with manufacturers to update the product's safety information, end quote, and that it was urging healthcare workers to, quote, inform patients, that's what informed consent is, about the potential risk of long-lasting, possibly weeks to years, sexual symptoms persisting after stopping SSRI or SNRI treatment, end quote. Earlier this year, the Australian health authorities also decided to require the amendment of patient inserts, quote, to reflect the risk of sexual dysfunction persisting in some patients after drug cessation, end quote. The FDA, however, has declined not only to take action, but also to answer the petition 6 years ago, even though U.S. law requires it to respond within 180 days of receiving a petition. Patients who submitted case reports to the FDA have not been contacted by the agency. They can't be bothered with that. Too busy making money. Now, the Public Citizen Organization has filed a lawsuit against the FDA on behalf of Dr. Antone Soka, a researcher into PSSD, which is post-SSRI sexual dysfunction, and a scientific advisor for PSSD Network. The suit alleges that the FDA has behaved unlawfully in failing to act on the petition, and it asked the court to order the FDA to issue a decision. As a reminder, this was filed in 2018. Clearly, the FDA has no intention of doing anything about it. Quote, the FDA needs to act in a timely way, I think we're past timely at this point, to inform the public about the risks associated with use of these drugs, end quote, said Michael Kirkpatrick, an attorney with Public Citizen and lead counsel. Quote, the FDA's failure to act exposes consumers to potentially lifelong harm, end quote. We all know the FDA doesn't care about public health. Joseph Witt-Doering, a psychiatrist and former FDA medical reviewer, says he has spoken to dozens of patients with the condition who describe it as, quote unquote, torture. Quote, it's not just the sexual dysfunction that persists for years after stopping the drug. They also feel totally disassociated from life, almost as if they're watching their life play out on a screen. They can't feel anything, end quote, explained Whit Doering. The answer provided by many sufferers has been to end it all, as Dr. Healy describes. Many people who are left with PSSD conclude that if they're going to feel this way for the rest of their lives, what's the point in living? This is horrible. The FDA has known about this for decades. They have refused to answer the petition for the past 6 years. Meanwhile, we know antidepressants are one of the most frequently prescribed drugs that exist. They're handed out like candy for things that are normal. If my spouse dies and I'm depressed, a drug's not going to fix that, but they prescribe it for it anyway. They're making money hand over fist. They're compromising people's well-being, and they don't care because there are no consequences to them. When are we going to hold them accountable? People, please, you cannot trust the FDA. You just can't. Do your own research, make your own decisions, work with your doctor to try to find out what the best approach is for you, not just the latest and greatest drug. Ladies and gentlemen, only the truth will set you free. Stay tuned for the next Daily Dose.